Hey folks, Dale Davidson here, the Dear VA guy. It's a great day to have a great day. So anyway, hey, let's jump into the video today. We're going to look at the changes in the VA diagnostic codes and what you need to know. So, don't know if you know, but you know the VA updates its schedule of rating for disabilities to ensure accuracy, I guess, okay? And so they're going through that process right now, and this is to make sure that disability evaluations align with what the current medical environment is, and understanding and treatment practices and all of that. So these updates, which include changes to the VA diagnostic codes, can really impact you and impact your rating for service-connected conditions and the compensation you receive. So you need to stay tuned and listen, okay? You got to be informed about these changes because they're essential to ensuring that your benefits reflect your current health needs. We're going to look at a breakdown of what diagnostic codes are, why updates happen, and how these changes can affect you. So, exactly what are diagnostic codes? They are a number. They're just numerical identifiers assigned to specific medical conditions. And these codes form part of the schedule for rating disabilities that the VA uses, okay? It's just a standardized criteria for assigning a disability rating based on the severity of a condition. It's a number, is all it is. For example, hypertension or high blood pressure, that code is 7101. Okay. Post-traumatic stress disorder, or PTSD, is 9411. Okay. Arthritis, and specific degenerative arthritis, is diagnostic code 5003. So again, it's just a number. Like when you go to the doctor and that doctor's got his little, it looks like his notes is he checks boxes, you know. Those are all different diagnostic codes. The same way with your doctor, the same way with the VA. So each diagnostic code outlines the symptoms or medical thresholds to qualify for a specific rating percentage. And those percentage, again, they go from 0% to 100%. So again, just a number. So exactly why does the VA update diagnostic codes? Well, they do this periodically they want to make sure that they're keeping up with the science, keeping up with the medical science, okay? So they want to reflect advances in medical science. So we have new diagnostic techniques or treatments, and they may change how conditions are understood or managed by your doctor, okay? There's always different tests, maybe a different kind of machine or whatever it is. So they're just trying to look at those advances in medical technology and medical science. They're looking to standardize evaluations. Updates ensure that similar conditions are rated consistently, okay? And they want to simplify the claims process. I don't know how they're going to do that, but consolidating overlapping codes can make some evaluations clearer and reduce some confusion. I've worked on several cases where there's really not diagnostic code for a certain condition, so we have to look at codes that are similar and make arguments, legal arguments that, hey, because of this, because there's no diagnostic code for this condition, this is the most similar one, and we need to use that code. So, what are some recent changes to VA diagnostic codes? Okay, cardiovascular system disorders. Wow, big words. The VA updated criteria for conditions like hypertension, high blood pressure, okay, heart disease, and arrhythmias. Okay. Blood pressure ratings, thresholds for systolic and diastolic readings have been clarified to ensure an accurate ratings for hypertension. In order to qualify for hypertension, by the way, under the code or the diagnostic code, your blood pressure, your diastolic has got to be at least 90, and your systolic has got to be at least 160. Okay, I think I've got that right. Still looking at the heart and high blood pressure and all that, they want to look at the functional impact, because some conditions emphasize how they affect daily activities rather than just the medical test results. So you may have a heart condition which you can't do certain things now in your activities of daily living that you could have done because of the heart condition. Let's touch on mental health conditions. The diagnostic codes for mental health disorders such as PTSD, depression, and anxiety have been adjusted. Normally we look at the DSM-5 for that, and that's updated on a regular basis. So these ratings now better reflect the functional impairments caused by mental health conditions such as difficulty maintaining relationships or employment. They try to provide a clear distinction between mild, moderate, and severe impairments. But mental health conditions are very, very difficult to do as far as distinguishing between mild, moderate, and severe. But at least they're trying. Then we had respiratory disorders. The VA has revised ratings for asthma, COPD, and other respiratory conditions. They've got pulmonary function test thresholds that have been updated to align with current medical guidelines. Okay, they now use assistive devices like oxygen as a factor more prominently into ratings. Maybe you have a CPAP machine. I don't know. So you have musculoskeletal conditions. Okay, they've updated conditions like arthritis, back pain, and joint disorders to focus on improving clarity around range of motion testing. That's been very difficult over the years to get the range of motion testing consistent among the healthcare providers. They're looking at consolidating codes for conditions with similar symptoms, such as degenerative disc disease or intervertebral disc syndrome, They're looking at skin conditions, codes for skin conditions, such as scars and eczema, and they're trying to streamline those types of diagnostic codes because there's a lot of overlapping conditions that can fall under broader codes to simplify an evaluation. There's cosmetic and functional impacts, and they're more explicitly outlined in the new skin condition diagnostic codes. So those are just kind of the tip of the iceberg, but how do these changes affect you? Okay, potential changes can lead to, number one, maybe an increased rating. That'd be great. So if the new criteria better reflect the severity of your condition, you could increase rating, which means more money. But caution, these updated standards may consider your condition to be less disabling. So you get a decrease in rating. So be careful. Maybe there's some conditions that remain unaffected even under the new criteria. So it may be good, maybe bad, or it could be no change at all. You may get a letter in the mail from the VA saying that based upon our new diagnostic codes reevaluation, we're going to look at your condition and update your condition based upon this code, and that could affect your disability rating. Now, be careful. Again, they could decrease it. So if they do decrease it, then you have the right to appeal that decrease. So if they don't contact you and say, hey, we're going to reevaluate that, you may look at wanting to reevaluate your disability yourself through medical records and from your doctor, okay? And that if they're not approaching you to reevaluate, but you think you're due to a higher rating, then by all means contact the VA to request a reevaluation. Again, if you believe that the changes to your rating due to these updated diagnostic codes is not right, you always have the right to appeal. Okay, so work with your VSO or somebody like us to help you with your case. So, what do you need to do if your diagnostic code is being changed? Check the VA website, okay, or consult with your VSO or us to understand how these new criteria apply to your condition. Now let's look at your old rating and compare it to your new rating. Now, if your new rating is lower, then why? Maybe, again, because of the diagnostic code change, so we're having to look to see what do we need to do to get your rating back up. File for a reevaluation. If the new criteria suggests you qualify for a higher rating, by all means, do a reevaluation, and that's you just file your 521, 526 EZ form. Okay. Now, through all this, know that you're going to go through a CMP exam. Okay. If they don't schedule you for a CMP exam, insist on one. If you think that you're due to a higher rating and they're not giving it to you, insist on a CMP exam. Okay, they have a duty to assist. So look, changes are not always good, and changes are stressful. And changes to the VA diagnostic codes are designed to ensure that the system's fair, consistent, and takes into consideration the latest and greatest in medical technology. Although I know that the government's always way behind everything else. But anyway, so these updates can be complex, but they are also opportunities for you to secure an accurate rating and better represent your condition. Now, you got to stay informed. Seek guidance, okay? Make sure the update works in your favor. If you don't think it represents, if in your opinion that you should be at a higher rating, by all means, let's go for it. If they reduce your rating and you think you should be back to where you need to be at a higher level, by all means, let's file the appeal. Okay, we're here to help you make sure that you're receiving the benefits that you are entitled to, because you served our country, and we do appreciate that. So, for more information about the VA's schedule for rating disabilities, you can contact the VSO or you can contact us. But remember, staying informed is the first step to protecting your benefits. Folks, thank you so much for tuning in today to the Dear VA Guy. Hey, check out this video. Warning, VA claim errors could be costing you thousands. For more information. And until next time, you have a blessed day.